Preparation. Arrange all equipment for the procedure in order of requirement on a sterile surface. Reassure the woman and tell her what is happening at each stage of the procedure. Ask the woman to relax her pelvis as much as possible. Use leg supports or a wedge cushion to tilt her pelvis to the appropriate angle. Perform a vaginal examination to determine the position and size of the uterus. Then insert the speculum while asking the woman to exhale deeply while relaxing the muscles of her pelvic floor. Ensure that there is a clear view of the portio, and if necessary, cleanse this with an antiseptic gauze. Stabilize the uterus by grasping the anterior lip of the cervix with a tenaculum forceps. Ask the woman to cough at this moment to minimize discomfort from the forceps. If the uterus is in a retroflexed position, it is advisable to grasp the posterior lip of the cervix. Stretch out the cervical canal with the forceps, applying light traction. Probe the cervical canal and the uterus to determine the length and position of the uterus before opening the IUD packaging. If the probing is unsuccessful or presents any difficulties, it is advisable to refer the woman to a gynecologist. Insertion. The IUD is easily inserted using a one-hand push-in technique. Step 1. Prepare for use. Open the sterile IUD package. Set the white ring according to the recorded uterus length of the woman and take the IUD out of its packaging. The IUD is now ready for insertion. Step 2. Insertion. Maintain light traction on the uterus with the forceps. Insert the IUD carefully into the uterine cavity up to the fundus. The white ring now touches the portio. Carefully remove the insertion tube with a light twisting movement. The IUD is now released into the uterus. Step 3. Completing the procedure. Trim the nylon threads to about 3 cm from the portio. Finally, remove the forceps and the speculum and provide the woman with a sanitary towel. From the moment the IUD is inserted, the woman is protected from pregnancy for a period of 5 years. Removal. Replacement of the IUD. The IUD can be easily removed by pulling on the nylon threads with forceps. A new IUD can immediately be inserted if required.